Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what is the classification criteria of rheumatoid arthritis? Okay, this is the new classification criteria of rheumatoid arthritis. Here there are four parts: one, joint involvement, then we have serology, then we have acute phase reactants. So first, in the joint involvement, if there is involvement of one large joint like either the shoulder joint or elbow joint or the hip joint or the knee joint or ankle joint, then it is given a score of 0. If there are 2 to 10 joints involvement, if there is 2 to 10 joints or 10 large joints are involved, then it is given, if there are 2 to 10 large joints are involved, then it is given a score of 1. If 1 to 3 small joints are involved, what are the small joints? Metacarpophalangeal joints, proximal interphalangeal joints, thumb interphalangeal joints or metatarsophalangeal joint or wrist joints are involved, then it is given a score of 2. If there are 4 to 10 small joints are involved, if there are 4 to 10 small joints are involved, then it is given a score of 3. Then, if more than 10 joints are involved with at least one small joint, if there are more than 10 joints are involved, then it is given a score of 5. Okay, this is joint involvement. Second, we have serology. Okay, in the serology, if there is negative rheumatic factor plus negative ANCA, that is ACPA, anti-citrullinated peptide antibody, citrullinated peptide antigen antibody is negative, and if there is low positive, yes, if it is negative, if it is rheumatic factor negative and anti-citrullinated peptide antigen is also negative, then it is given a score of 0. Now, if it is low positive rheumatic factor, or if there is low positive anti-CCP antibody, then it is given a score of 2. What does low positive mean here? Low positive means that it is at least 3 times, it is less than or equal to 3 times normal. It is less than, actually it is less than 3 times the upper limit of normal, then it is low positive. Then we have, if there is normal high positive, if there is high positive rheumatic fever, or if there is high positive, okay, anti-citrullinated peptide antibody, in such cases it is given the score of 3. What is high positive means? High positive means there is more than 3 times the upper limit of normal. Anti-citrullinated peptide antibody is more than 3 times upper limit of normal, then it is given a score of 3. So this is serology. Then we have acute phase reactants. Okay, in the acute phase reactants, right, in the acute phase reactants, if there is normal CRP and if there is abnormal, if there is normal CRP and normal ESR, then it is given a score of 0. Now, if there is abnormal CRP or if there is abnormal ESR, that is either one of them is abnormal, then it is given a score of 1. Then we have score based on duration of symptoms. Okay, if the duration of symptoms are less than 6 weeks, then it is given a score of 0. If the duration of symptoms are present for more than 6 weeks, then it is given a score of 1. So overall, if you see, out of score 0 to 10, out of the score 0 to 10, if the score is more than or equal to 6, then it is definitely rheumatoid arthritis.
Thank you and thank you for watching.